You're an MD?
Yes.
This is Dr. Louis Cornacchia of Doctations, which is, as I understand it, kind of a whole physician. It's a PHR, but everything a physician needs to run his practice.
Yes. Yes. Early on in the year 1996, I built an EMR system to run our practice. And the EMR system actually was connected to a billing system that I built as well. And what I found was, even though I was in a building full of doctors, my EMR system did not help me connect to any of the other doctors. And so I recognized that having a siloed client-server system wasn't the solution, and that Google had the solution. If we can apply the Google concept to healthcare, we could actually change the world.
Really?
I think Google has something else, at least a perception of doing the right thing. And I think the key components in making all this work is you need a fully comprehensive software system that runs the entire medical practice, from front desk to back office to clinical processes, medical record keeping, scheduling, task management, messaging between people within the office, SMS messaging as reminders. All of that has to be built into one package. And the idea that you would have best of breed doing various processes is like saying, I'm going to go buy a Mercedes, and I go buy a Mercedes, I buy a fender in one store and a fender in another store, and I buy wheels there and a steering wheel somewhere else, and I end up with the best possible car, which is ridiculous. So you want a fully integrated system, and that's what we've built. And the other part of this is it has to be patient-based. Healthcare takes two. Okay, it's not just the doctor, it's the doctor and the patient. And so you need a system that in fact is equivalent for both. You want one database, one software system, one set of applications that essentially is being accessed by both doctors and patients in the appropriate HIPAA-compliant business rules way, so that privacy is maintained with the doctor's records internally, but the doctor can share medical records so the patient has a copy. This is something that in my mind, is a complete game changer in healthcare. Once you begin providing the tools and then the collaboration into the same layer, so that the networking is built into the EMR, the patient component is sharing, the patient is sharing internet space with the doctor, you're creating a catalyst which will completely transform healthcare, as long as you have the third component, which is complete honesty. The system and the way it's managed has to be honest, which means that we have to be honest about how the data is going to be used. We have to be honest about how the data is going to be distributed, because it's patient data.
I understand the data actually is put in trust.
That's right. We're putting our data in private.
Data and you don't have access to it.
Well, we said that in our subscription agreement very, very bluntly since day one. We said we don't own the data, the doctor owns its own data, and if the patient has a copy of the data, the patient owns his or her copy of the data. And we don't own it. We won't resell it. But then we needed to put that into a legal structure where it couldn't be changed. Okay? And that is a venerable legal structure called the private trust. I think we're the first company in the world that's ever done this. As far as I know, our attorneys don't know of anybody else.
People just wouldn't believe you.
I think that's the concern, but it's also the possibility that internally someday I might not be running the company. Someday someone else might take over, and then they change the rules. Not acceptable. And if I built this company, as a physician, it's important to me that my chart on you never gets to anyone's hands.
So you don't sell the data to drug companies?
No,
research
no, it's not. It's just not acceptable. These are medical charts, and the essence of the relationship between the doctor and the patient, the foundation, is trust.
You don't sell it even anonymized?
No, there's no such thing. Anonymized data there's no way to fully or guarantee that any data set is anonymized. It's not possible. It's a fully integrated system, so that when I check in a patient in my office, the claim is already generated. And if I code that myself while I'm seeing the patient and I dictate something, the dictation is done in 2 hours. The code is actually integrated into the claim when the patient's checked out. The claim is pre-scrubbed and it's automatically submitted to a clearinghouse within 4 hours, typically.
Really?
The person never touches it. Right. So I have a guarantee right on my screen. If I check the next day, it's paid. I can just look at it. Or it's been submitted. I can see what's been paid and what's been submitted. It still has to go through a clearinghouse in the 2-week payment period, but most of this now the likelihood of this being returned to me is unpaid is pretty small, because in fact I've eligibility checked before the patient was even seen, and I pre-scrubbed the data when the patient was checked out, and I've actually pre-scrubbed the data when it was sent to the clearinghouse. So the scrubbing, we're using, it's a 3M system with 3.4 million rules applied to each claim, is a very sophisticated scrubbing system. So it's the same system being used by Athena Health, for example. It provides a good means of assessing the quality of the billing data before it ever leaves the office. We have this free tier. We have from the beginning, but it's kind of a good way to get to try the system. Truthfully, if you're going to run a medical practice in today's day and age, you're going to need e-commerce structures like eligibility checks, pre-scrubbing of the claim before the patient is checked out from the office. You're going to need to be able to do things like computer-assisted coding or coding checks. You're going to need to be able to do things like claim submission to a clearinghouse or to multiple clearinghouses, and automatic claim status checks.
And all of those, that's all built in.
But it costs money, and so there has to be some fee associated with this. So when the honesty is here too. Right on our site we say, yes, there's a free tier. You can try the system. You can run your practice using task management, using scheduling, all the same modules that everyone else is using. But if you want to start using eligibility checking, if you want to start using automated telephone reminders, all of the e-commerce functions, then basically you have to pay a fee.
How much does all that cost?
Well, if you're part-time, you're working part-time, you're an older doctor, you're going in 1 day a week, it's going to be $35 a month.
$35 a month.
And if you're full-time, okay, and you're using it every day, it's $183 a month. $183 a month, and that's based upon our costs in providing those services. For example, we're not providing a cut rate pharmacy database. We're using the gold standard, which is First Data Bank. First Data Bank is owned by the Hearst Corporation. It's a major effort to maintain a pharmacy database and the interaction database, and all of the other data they provide us on a monthly basis and is updated monthly. That is critical to us. That is the essence of good care, is to make sure that all of that data and the cross-reaction data is being maintained professionally. And for us, that means having it maintained by an entity that does just that. And so that's...
So you have to go out and buy these services.
That's right, and they're expensive. And so we pass that cost amongst all of our users over time.
How long have you been doing this? How long has this thing been up?
We have been working with a selected group of physicians now for 3 years, specifically building out the infrastructure required to handle every doctor's workflow. The adage is, if you've worked with one doctor, you've worked with one doctor. Exactly. You know it as well as I. They're all different. Why? Because the complexity of what they're doing is substantial. Right. Someone said that running a small practice is like, or a small clinic is like running a NASA mission to the moon. There's so much data flowing through that most doctors give up hope of ever tracking everything down. Our system has the ability to actually assign every single function in the practice to a specific individual in the practice or outside the practice, so you can virtualize the entire process. We're open sourcing iMedical Home so that people who are inventing in the Health 2 sphere can actually connect to our system through the open source modifications or through the API. And we're actually beginning a licensing program where we're going to license the source code to universities and government agencies. And we're talking about 4 years of work by a large, relatively large team of engineers and physicians constantly working through this over 4 years.
So they want to bring out
So
their
you're
own
talking
version.
6 million plus lines of code altogether.
Wow.
That has been actually written and rewritten and honed over a period of 4 years.
And you put it out there as open source.
Absolutely. So it's not quite open source, it's licensed. The concern I have about open source, and I've discussed this with a number of people, including Fred Trotter, for example, by email, who is a big proponent. I love him. He's all open source. He's all for it. But the fact is that I still believe that there are issues regarding security if you open source the back end. And if you know, for example,
who knows what they could build into it?
Absolutely. Look at SQL attacks. You can actually, if you know that a particular field isn't properly protected for a particular, then you know how to get into our system through one particular field that allow you to attack our database. We held focus groups with doctors and patients. Yeah. Lots of them. I mean, literally well over 130 physicians involved in discussions, well over, 4 or 5 dozen patients involved in discussions, actually sitting down at meetings for hours talking about things. This is what I discovered was that although doctors are worried about malpractice and revealing too much and being burdened by these IT systems and having to answer emails all hours of the night, etc., and it's going to get worse and worse, and IT will make it worse. Actually, the patients are more concerned about the welfare of their doctors than the doctors are. That was shocking to me, and people need to sit down with groups of patients. They'll be surprised. I'm not sure I'd want that feature because it might burden my doctor too much. And
very funny.
And truthfully, a good, solid doctor-patient relationship is a form of friendship, and it is an honest relationship. And so that relationship carries with it those nuances, and it's important that we not damage that.